Hey everybody! Ging? Ging, where are
Hi.
you? Ging?
Sorry I'm late. I was checking out our previous pit stops
Hey!
to see where we left off.
Oh, well, you could have just asked me, right? Anyway, on our previous pit stops, we talked about speech pathology as a career, its past, present, and future, and the universities that offer it as an undergraduate course. So if ever you missed it or you want to revisit those topics, you can go ahead and check out our FB page, the Speech Path PH.
Yes. Oh, I do remember that at every pit stop, we prepare a special gift. And since this one is the last, we made it extra special. Zareen, do you have any idea as to what that is?
If I'm not mistaken, today's gift is another raffle for you wonderful people. And for those green thumbs out there, this raffle will reward each of 2 winners with a set of 3 succulent plants from the one and only Suck Seed. So make sure to share this video, caption it with your highlights, and use our official hashtag, the SpeechPathPH, and hashtag SpeechMath.
Yes, SPEECHmas is truly the season to be jolly.
Yes, it is very, very true, gang. However, ever since we started this event, there's this question that just keeps me up at night. And don't get me wrong, I feel like being a speech pathologist is very fun and so fulfilling. However, I've been wondering, if I wasn't Santa's helper right now, will I be able to handle it? A life of a speech pathologist.
Don't worry, Zareen, because SPEECHmas is here to help you and everyone realize or understand what a life as a speech pathologist could be like. And that is why, for today, we have invited not just professionals in the field, but students who one day aspire to serve as speech pathologists. Now, let's all listen to their testimonials.
Let's go!
Hi, my name is Howell Henryan Bayona. I'm a speech pathologist working in 2 hospitals here in Metro Manila, where I primarily see kids up to adults with feeding and swallowing difficulties. I've been working as a speech pathologist for almost 8 years now.
Hi everyone, I am Georgia Danga and I am a speech language pathologist and a speech pathology lecturer at UP Manila, and my astrological star sign is Virgo.
Hi, I'm John Posadas and I've been a speech pathologist for 5 years now. I am also a teaching associate for the Department of Speech Pathology in CAMP.
Hi, I am Ayel Dominguez. I am a second-year BS Speech Pathology student from UP Camp.
Hi guys, I'm Jamie Bakiran, a second-year Speech Language Pathology student from the University of Santo Tomas College of Rehabilitation and Sciences.
Hello everyone, my name is Via Adeline and I'm a first-year BS Speech Pathology student from the University of the Philippines, Manila.
I first heard about it when I was in 3rd year high school. At that time, I was trying to pick a course to take in college.
So the first 2 questions are where did I first hear or learn about speech pathology, and why did I choose SP? My answer to these 2 questions are connected, as I really did not know what SP was when I was filling out the UPCAT form. The name of the degree program sounded cool and good, so I ended up putting it in the form as my last choice for my last campus, which was UP Manila. My first choice was actually journalism in UP Diliman. When the UPCAT results came out, apparently it was the only degree program that I got into, despite it being my last choice. I ended up pursuing it anyway, and I eventually ended up finishing it.
I first heard about speech language pathology when I was in 10th grade. There was a career seminar in my previous high school, and the speaker, talked about what SLP, but it was just a brief explanation. But I got curious on what is it because it was my first time hearing it, so I did my own research. But the really first time that I got to learn what really is SLP is that when I was in senior high school. So I was under the Health Allied strand in UST, and one of our subject, work immersion, gave us the opportunity to visit the SLP lab and to observe how interns do their therapy sessions. And as the interns explained to us on what really is SLP, and that's when I realized na I am not just curious about this course, but it's something that I want to pursue.
I first learned about speech pathology when I was in 8th grade. During this time, my mom was finishing up her master's as a special education major. So, in one of our conversations talking about my future career choice, she mentioned OTs, PTs, and of course SPs that help contribute to the growth and development of children with special needs. It was mentioned in our MAPE program in our health part that aside from doctors, there are other healthcare professionals, and one of them was speech pathologists. So, for the second time in my life, I heard what speech pathology is. So, I looked it up online and thought, oh, this is a viable career choice.
I think I first heard of speech pathology when my sister was filling out her UPCAT forms back in 2011 or 2012, I think. But it wasn't until grade 12 that I really found out who SPs were. So my friends and I, we decided to take sign language classes. And in order for us to learn, we were immersed with the deaf community. And that was a really great experience, an eye-opening experience. And because of that, I was more curious about their culture and their sickness. And so I decided to do more research and ask people around. And that's when I truly found out who SPs were.
So I chose it primarily because I was looking for a pre-med course that also has a good job outlook or that is in demand. My friend then in high school told me that speech therapy or speech pathology is an in-demand course, especially if you want to work abroad. So job security is always a good point for the program.
Virgos are known to be practical. So I chose this path because number one, it was in demand. And true enough, napakaraming tao dito sa Pilipinas ang nangangailangan ng speech therapist. Number two, it was financially sustaining. It pays. Hindi naman kalakihan, but enough to earn a living. And number three, and most importantly, I really wanted to help lives and help change lives. Plus, I chose something in the medical field na wala masyadong math.
Back when I was still choosing a course for college, all I know is I want something in the science field as well as I want something med related. I don't want common courses here in the Philippines, and that's where SLP comes to mind. Similarly, as a person who is very passionate for service, I want to embark on a lifelong journey, a career path where it will enable me to, provide service for others. And one of my philosophies in life is that service is the purest form of self-improvement.
My interests were very broad. I have interests in the sciences, I have interests in medicine, I have interests in linguistics, in humanities, and among all those things, I thought to myself, oh, speech pathology is something that has all these things together. And ultimately, I chose speech pathology because I knew that I would like to have a career that offers service to other people.
It has always been my dream to become a doctor since I was younger. So while I was filling up my college application forms, all of my choices were actually pre-medicine courses, including BS Speech Pathology. What really pushed me to go with speech pathology was that in case I wanted to pursue speech pathology, I can do that. And if ever I still want to pursue medicine, I can still also do that in the future. Since BS Speech Pathology is a great option for a pre-medicine course.
So I said, I've been working 8 years. It's very challenging, to be honest. A lot of times you wake up asking yourself why you're still doing this. It's very, very hard. But I guess what motivates me to keep on practicing, seeing clients, is number one, a lot of these people actually need help, and not a lot of people can actually give them the kind of service that they require, and that usually comes from speech pathologists like us or like me. So that's the main thing, no? Seeing these people badly wanting to be able to eat again, talk again, or see their child grow and be successful individuals when they grow up. So that's the first one. The second motivator is, I guess, it's the intellectual challenge that comes with the job. It's a discipline that's still growing, so a lot of the science still has to evolve. And so I think, and I love learning new things. So you wouldn't run out of new things to learn when you work as a speech pathologist. That I can assure you. Every new case is different. Every year, something new, new studies come out, and so it's always full of new developments and growth.
Beginning internship where we go to different clinics, different hospitals for duty. That's on our last year of studying before graduating. Doon ko na-discover na, wow, I might really actually enjoy being a speech pathologist and really have fun and really like it. With my interactions and sessions with my patients, I get to apply creativity and resourcefulness in my sessions, which I really, really like. And also with my patient interactions in internship, that's where I discovered my genuine love and genuine passion for teaching.
So first, as a student, what made me stick to the program and finish it was actually the very last year of being a student, which was internship year. Up until that point, I was asking myself if SP really was for me. I think this is a question that a lot of students ask themselves as they go through the process of being an SP student. Um, what turned it around for me, or what actually convinced me that it was something that I can pursue, was working with patients with a cleft lip and palate. Um, I figured out that this was a profession that I can pursue because it was really rewarding to see the small incremental positive changes that happen to a person with cleft lip and palate during the speech pathology process. As a professional, it was actually not clinical work that motivated me to stay in the profession. As a professional, there were still times when I thought about pursuing other career options. But what made me motivated to stay as an SP was actually classroom teaching. Teaching was something that I looked forward to doing, and it was a really pleasant experience to help and facilitate the learning of SP students and guide them through the process of being a speech pathologist.
What really motivates me to study SLP, is that I know that after 4 years of hardship, 4 years of puyat, breakdowns, and all, I'll be able to be a professional, a speech language pathologist who will provide service as well as change the world one word at a time.
So, what motivates me to finish this program is that in the past 1.5 years, we've been learning about the basics and the theories behind speech, language, and swallowing development. So, with this knowledge, I am very excited to learn about how speech pathologists diagnose and eventually treat disorders regarding these three aspects in life. There's also this realization that talking, eating, and conversing with other people are complex processes that we actually do daily but not thinking about it. Well, for most of us, it's easy, and speech pathologists are there to help people who struggle with these kind of activities.
As a first year student, I think I should still have a lot of motivation left. And I think I do naman. And that's mainly because of my curiosity and this desire I have to feed that curiosity. As the days go by, I find myself more curious about the profession and what it entails. And since my professors and peers are doing a great job in feeding that curiosity, I find myself looking forward to the years ahead.
I can remember sitting in class together with 30 women, and there were only two of us who were boys. And it's the same also for the other batches. So it's a program predominated by women. So you have to get used to used to it. I also remember seeing, touching, and smelling a cadaver for the very first time. I cannot forget that experience. Of course, the usual college activities. And lastly, the internship. That was very memorable for me because I think I've grown so much over that 10 to 12 month period, emotionally, intellectually, and also physically. So there, as a professional experiences, of course, when you work with a lot of people, you experience all sorts of things, diba? Working with people from the lower socioeconomic groups up to those who are extremely rich. So you get to see uh, people from all walks of life talaga. You also experience the challenge of trying to make people aware of what you do, especially those who are already in your workplace. So like me, the doctors in the hospital, for example, the nurses, that's still a challenge up to this day. Getting the recognition or the attention, I guess, it's still a challenge for the profession. And trying to develop or start new things and apply what we learn, those are the usual experiences I have when working.
The course itself was a challenge for me because I consider myself a creative spirit. And from first year to third year, yung mga inaaral ko, very ano siya, left brain. And it really felt like my brain was not really wired for this. My student life was honestly very hard for me, but I was very fortunate to have friends, to have classmates, and we really helped each other. Actually, I didn't graduate on time, and that's completely okay. Wala naman siya naging negative effects or anything to my search for employment. I work with children with special needs, from toddlers to teenagers. I also work with stroke patients and patients with cleft. So, ang current setup ng work ko, hindi pala siya current kasi naiba siya during the pandemic. But the usual setup of my work is I go to different clinics, different hospitals, every day iba-iba. So yeah, I have worked as a consultant in different settings. I've worked in private clinics, I've worked in hospitals, I've done home-based therapy, and now teletherapy. What I also really like about being a speech pathologist is there is a sense of freedom with my time, and because of that, I have more time to do other things that I am passionate about. I get to volunteer for different non-government organizations. I also get to speak about mental health. I get to travel. I get to travel for recreation. I get to travel for work. I get to travel for continuing education. But above all, personally, this flexibility in my schedule allowed me to achieve my dream of becoming a writer. And these things I do all while practicing as a speech pathologist.
For my experiences as a student, well, first of all, I miss campus. Online setup is not really my thing given that SLP is a really hands-on course, especially for laboratory subjects. No? Pero I'm telling myself to enjoy it one day at a time, which is I'm really enjoying, especially na I get to apply all the theoreticals to the practicals na in handling patients in the future. And then lastly, I'm telling myself as well to enjoy it one day at a time. Similarly for all of my requirements, finish them at least one day at a time.
This last summer, the SP department has this initiative called Usap Tayo. Usap Tayo provided free home programs for those who seek it. So I was able to volunteer for a number of those cases, and it was actually nice to contribute in making home programs and actually getting feedback from our profs and of course sometimes the caregivers or the parents of the clients. And it's nice to hear that what we do actually works and helps them with their struggles. It's very nice to have a group of people, your blockmates, to have you with you in your whole journey. It's a struggle to learn all these things we need to learn, but it's less of a struggle with a block that is very supportive and has your back along the way. Your block is your shield to the world and the dangers of being delayed. So, appreciate your block and you'll eventually bond over your struggles, especially when you join the talent show, the annual camp talent show, which in the end, of course, it's very happy and very fulfilling to have fun with not only your block, but also all the blocks in camp as well. So, look forward to that because you might see your profs dance their way at the end of the program.
Although my experience as a student is very limited, I think I can already say that the SP community is truly a welcoming and a supportive community. And it is also a relatively smaller community compared to other professions. Being part of the SpeechPath PH, the organizers of this event, I can truly say that the support of the SP community has made this whole experience much more fun and fulfilling than it already is.
Challenges, as I said, you wouldn't run out of challenges when you work as a speech pathologist. Every new case is a complicated problem. It would drive you to your limits talaga, which can be good or bad depending on your personality. The most memorable moments would be, it's the simple things like seeing one person or one client being able to drink water again after a long time. You would remember that for sure, the look on their faces. I also remember a lot of times when patients who have a tracheostomy tube, who are not able to talk for months now, finally hear their voice again after putting a speaking valve. So those things are the ones that stick the most. And maybe just the individual personalities, these people that you meet from clinics. You know? And you often work with them for a long time since rehab is like that. And so you would develop a deeper relationship with them. At first, you would be healthcare provider and client, that sort of relationship. But as time goes on, you would become friends. You would also become friends with their family members. You get invited to binyags of their apo or other family events. So those are the things I remember the most from working.
It's really priceless to see your patients make progress. It really fuels your spirit and it really makes you want to do more. It's really heartwarming to see them empower themselves to make change, to make good change in their lives in their own little way every single day. And you just look at them and you see and realize that you've taken part in that and you really helped make that happen. And at the same time, you also learn a lot from your patients.
I think the most challenging experiences as a student for me were the practical exams. These exams are where students are tested in their clinical skills by performing assessment and intervention procedures in front of your teachers or your professors. Those were really the most nerve-wracking exams that I've ever taken in my life. Those are really hard and nerve-wracking. They were fun though because it felt really cathartic when a practical exam is finished. For challenging moments as a professional, I say that it's really hard when your clients are seeming to be making no to minimal progress for a period of time. This could lead to confidence issues for an SP and kind of makes an SP question their own competence. I've also experienced this. Plateaus during therapy, they do happen and they are challenging, but often you just need to find out why it happens and adapt your therapy accordingly, optimize all the variables and take all of the factors into consideration. And then that way, you can be back to making progress again.
One of the challenges of being an SP student is that you need to realize and accept the fact that simple concepts are not simple. It's more complex than you think. There's a whole new world to the complexity of how we speak, how we eat, or how we swallow. And there's a beauty to that complexity. You just need to find that silver lining to appreciate all that information you're learning. There is a lot of material to learn. Speech pathology dabbles in a lot of aspects of life. So there's a little bit of humanities, a little bit of biology, a little bit of linguistics, and a little bit of everything actually, because speech pathology involves with helping improve people's lives. So of course we need to learn about that as well. And of course, because we have many ACADs, it's very, how can I say this, very challenging to balance your life as a student in speech path or work, and of course other responsibilities that you have. But of course, just because it's difficult doesn't mean it's not possible. So if you believe you can do it, you can do it. I'm very sure of.
Given this pandemic and the classes being done online, we can certainly expect for a lot of challenges. And being first year BSSP students, we are not new to these challenges. And I think what's really scary for us is that we won't be able to grasp the concept or gain the skills needed in order to be a capable therapist in the future.
I can't really think of a one event that can sum it up. Pero I'm thinking of the collective snippets of the challenges and memorable moments. So for now, I think what's really challenging is that as a second year student, it's online setup, as well as I'm also the president of our student council. So I get to juggle responsibilities for academics and extracurricular. Pero at the end of the day, it's really memorable in a sense na I know that I'm pushing myself to be a better person, to be a better student, as well as a leader. That's it for my speech path testimony. I hope that you will pursue SLP as well, or continue your journey in becoming a speech language pathologist who will change the world one word at a time. Thank you!
Dear Santa, for this Christmas, I'd like to wish that if ever I get reborn, I want to become a speech pathologist. Sincerely, your helper.
Dear Santa, please refer to Ging's letter because we have the exact same wish. Sincerely, your other helper. We should totally send these in. Like,
I agree. I mean, these lectures and all of these pit stops have effectively convinced me that a career in speech pathology is so worth it.
yeah, I can't believe that we finished all of it already. The only thing missing is our culmination where we can all meet each other. I can't wait.
Me too. You know, before we send in these letters to Santa, I would just like to remind all of you that our culmination is on Saturday, December 12th, 2020. I'm so excited to meet all of you. See you there.
Well, race to the North Pole, gang.
Bye.
We would like to thank Santa's special helpers that made all of this possible. This SPEECHmas is in association with the Philippine Association of Speech Pathologists, co-presented by the UP Collegiate Association of Speech Pathologists. Our major sponsors are the Arium Shop PH, Blank Slate, Kaka Kombucha, and Succeed. Our minor sponsors are Fan Shack, Mooncake Moonlight, and the UP Sigma Alpha Nu Sorority.